Hi, I'm Peter Chung. I'm president of GMA. In the past, GMA has done very well on mission trip with many lives positively impacted through these experiences. But I believe we can do even better. During the pandemic, we had a valuable time to reevaluate our mission trips, our goals, short and long-term impact, and sustainability of the work. Most of GMA staff took a training course and learned about community health evangelism. We also read the books that raise a question and challenge us to do mission trip better. These topics include the number 1, ensuring patient safety, number 2, promoting local healthcare system, number 3, focusing on community development rather than just relief, to give locals the ownership and eliminate outside dependencies. Number 4, focusing on the need of the locals rather than need of the locals. To address these important topics, we had multiple meetings with our regional directors and met in person in Denver to develop new strategy and principles for our GMA mission trip. We have decided to implement 3-part strategy on our mission trip. Number 1, local clinic. Number 2, community development. And number 3, children ministry. We'll first find a local clinic where we can go to empower the local health communities, and also ensure patient safety by working with a local physician who will follow up with the patient care after even they leave. Number 2, we'll engage in community development program in village associated with a designated clinic. One example of the community development program would be clean water program. In the past, we visited a village in Honduras. Many children suffer from diarrhea because of lack of clean water. It does not make sense to treat just a diarrhea problem without addressing source of the problems. Locals will initiate the community development program, and the ownership of the program will be given to locals. We can be instrumental to educating the local people about how to obtain clean water. Other topics that can be addressed include infant mortality, maternal mortalities, malnutrition, vaccination, communicable disease, so on. We can raise awareness of these issues to community leaders and provide the necessary education program. Eventually, it will be local to come up with their own solution to these problems in the process of being independent out of outside resources and become sustainable. We're also involved in training community health workers in the village setting, where doctors, nurses, pharmacists not available. These community health workers will know how to treat patients with a simple problem and refer patients with a more complicated problem to the designated clinic where the trained healthcare professionals are available. I took a team to Honduras for community assessment. We visited the government clinic where there is 1 physician, dentist, 2 nurses, and pharmacists. This clinic served an area of the 14 villages with total population of 4,000. We are asked to come to help the need of this healthcare clinic. We will also partner with the local churches, and we will spread the gospel message to meet the spiritual needs. The school in Centralita, Honduras, asked us to help educate the students in the health education and set up the computer lab and science lab. We are also asked to lead their students in spiritual training during their chapel time. The last is to implement these new strategies and principles of mission trip. We have developed the 8 weeks GMA training courses prior to mission trip. We'll teach you about having the right attitude to empower the locals, to understand the difference between the relief and development, and to know the proper goals of short-term mission trip in order to have a long-term impact. I'm looking forward to the future GMA mission trip. I'm excited to see what God will do in transforming communities as we deliver healthcare and assist community development. Thank you.
You're where my help comes from. Give me wisdom. You know just what to do.